Okay, so you know how when you go to the doctor and they check a few things like your blood pressure, heart rate, temperature, and breathing? Those things are called vital signs. So basically, vital signs are just important things that doctors check to make sure your body is working the way it should be. There are 5 main components: blood pressure, heart rate, pulse rate, respiratory rate, and body temperature. We will be using 3 paraphernalias: the sphygmomanometer, the stethoscope, and the thermometer. To start measuring vital signs, make sure to sanitize your paraphernalias properly using an alcohol and cotton balls, but you can also use sanitized damped cloth. But first, let me show you how to use this paraphernalias. Starting off with a stethoscope. This is called the chest piece. Make sure when putting the earpiece, the chest piece should be faced in the patient. This is an aneroid sphygmomanometer. This is what you call the aneroid manometer gauge, and this is the cuff. Oh yeah, one more thing. This is an inflation bulb. This is called the air releasing valve. If you turn it clockwise, it will allow air into the cuff and expand. The thermometer is really easy. You basically just put and press, then wait. Then you got your reading. We have 2 kinds of pressure, the systolic and diastolic. The systolic pressure is the top number and measures the pressure when your heart beats and pumps blood into the wall of the arteries. Diastolic pressure is the bottom number and measures the pressure when your heart relaxes. To start, make sure your patient is sitting in a comfortable and relaxed position. Wrap the cuff around the upper arm and secure it in place. Find the pulse in the brachial artery just around the upper arm. Then place your stethoscope gently. Inflate the cuff by squeezing the bulb until the pressure in the cuff exceeds your normal blood pressure reading. We will be cuffing until 160 millimeters of mercury. After cuffing, slowly release the pressure in the cuff by opening the release valve and watch the gauge to determine your blood pressure reading. The first sound you hear through the stethoscope indicates your systolic pressure, and the disappearance of the sound indicates your diastolic pressure. And always remember to note the reading and record it as systolic and diastolic. Taking a heart rate is super easy. You also need a phone or a watch for the timer. Put the earpieces of the stethoscope in your ears and place the chest piece just below the left nipple. Make sure it's in a spot where you can hear the heartbeat clearly. Then, listen to the heartbeat for a full minute, counting the number of beats you hear. After that, note it and record the result in BPM. Reading the pulse and respiratory rate is similar to the heart rate. First, find the pulse by placing your index and middle finger on the wrist, or what they call the radial pulse. Next, count the number of beats you feel for a whole minute. While taking the pulse rate, secretly count the respiratory rate by looking at the chest's rise and fall. After that, jot down the number of beats and identify it as BPM. There are several types of thermometer, but we will be using an oral one. To start, put the thermometer either the mouth or the armpit, but we will be using the armpit. Insert it gently and wait for it to give a reading. Remember, 37 degrees Celsius is the normal temperature. After it beeps, record the reading in degrees Celsius. Then done. You have now successfully measured vital signs. Make sure to take down notes on the reading, with blood pressure on systolic and diastolic, heart, pulse, and respiratory rate on BPM, and temperature on degrees Celsius.